Well, Canada is set to receive 1 million COVID-19 vaccine doses every week starting in April. That is not an April Fool's joke. That is good news, but it's still months away, and cases are out of control across the country. Responding to the grim reality, the federal NDP are calling on the government to immediately recall Parliament in a virtual manner. The House of Commons is set to reconvene the last week of January, but Jagmeet Singh says the federal government needs to pass urgent legislation, for example, for 10 paid sick days leave for all federally regulated workers. What more, though, can the federal government do in this new period to enforce lockdown orders or, say, help the vaccine rollout? Isn't that all provincial jurisdiction? Mr. Singh joins us now with some details. I haven't seen you this year, so Happy New Year to you, if we can say Happy New Year when the country's struggling so hard, Mr. Singh. But why specifically do you think Parliament should be recalled early?
Well, a number of things. You mentioned paid sick leave. We're hearing more and more from experts that this is one of the single most important tools to keep workers safe in this time. People are still going to work sick. So with paid sick leave, we want to recall Parliament virtually as quickly as possible this Monday so that we can expand the existing program that we fought for, make it easier to access, get rid of some of the barriers that people are mentioning when it comes to accessing it, make it more flexible, and also look at ensuring all federally regulated workers are entitled to accessing paid sick leave. We need to do whatever we can in our power, in our jurisdiction, so that people who are sick are not going to work. Experts are saying this is one of the most important things to preventing the spread. Secondly, long-term care is still hard hit. We need to bring in more protection and supports for long-term care. And finally, small businesses, as you mentioned at the top, they're going to be hard hit as some of the stay-at-home orders in Ontario and the curfews in Quebec and across this country, the lockdowns and shutdowns mean small businesses are hard hit. While big box stores continue, small businesses need help. So we need to pass urgent legislation to get more help to small businesses, to support seniors in long-term care, and to make paid sick leave easier to access.
Okay, just let me just break those down. Let's just stay on paid sick leave, which has been a big issue. A lot of some paid sick leave outside of federally regulated industries, as you're talking about, is provincial jurisdiction. Some provinces, when you first have raised this, and the Liberals have raised it, they've said, sorry, we don't want to do that to small businesses right now. What do you say to that?
Right now, there is no question that people who are going into work sick have an impossible choice. Do they go to work sick knowing that they could risk spreading an infection to their coworkers? Or do they stay at home not knowing if they can make the mortgage payment or if they can put food on the table? That is an impossible choice. We need to get around any sort of barriers and get to the hard work of making sure everyone in our country can access paid sick leave so that workers stay home and stay safe. There's no question about it.
But, you know,
there cannot be any political maneuvering to make barriers when we know that this is important. We've got to get it done.
But they already had the sickness benefit, which gives people up to $1,000 for 2 weeks if they're in the quarantine situation. But now you've got to have a new legislation, probably going to take priority, because the Liberals said there was a loophole in it that people who are traveling for vacation, non-essential travelers, they say they don't want to access that sickness benefit. So would you like that to be a priority, or is that really the sickness benefit that you're talking about?
Well, the sickness benefit that we fought for is a form of paid sick leave. Absolutely, we should close any loopholes that don't cover the people that we don't want to cover. But while we make those changes, we can actually make it more flexible. Some of the concerns raised by experts is that someone who gets sick needs a couple of days to figure out if they are sick or not, to see if it resolves, and then they can go back to work. But not knowing if they can take off a couple of days at a time, the current way is you have to take a block of time. You have to take the full 2 weeks at a time. Well, that may not be necessary, and so a worker doesn't do it. But they might need a day or two to figure out, okay, is this really some symptoms that I need to be worried about? That's actually something experts are saying would be very vital so people can make the right choice. A number of things in terms of the delay. Right now, it works like EI. So you apply for it and you get the help after the fact. There needs to be a way to make it quicker so people can access it more immediately, which is going to encourage people to use it. It's also not very well advertised. A lot of people don't know that there is a federal paid sick leave available. So there's a lot of things we can do, and we're saying, let's bring Parliament back, given how urgent this is, and change the loophole, absolutely close that loophole, but let's broaden paid sick leave so the people who need it most can actually access it.
Just a couple of things real quick. Do you think there should be an outright ban against non-essential travel, right? Not just, there's a recommendation now. I mean, you've had members of your party, every party has, the Senate has, the provincial governments have. People are being told, stay at home, lock down, don't travel, but yet they can still travel. It's just a recommendation. Should there be a ban, in your view, on non-essential travel right now?
Well, what I think about, Evan, on this point is that we know that people are making massive sacrifices within the same city, within neighboring cities. People are not able to see their loved ones in hospitals. When there's funerals, they are not able to attend. So people are making massive sacrifices on one side, but international travel is so easy to do still. So there's got to be some similar application of how serious this is, that people are making massive sacrifices, loved ones are making sacrifices. We have to then clamp down on the impact of travel and acknowledge that travel is related and linked to the spread of this virus. So we have to look at not just international travel, but people are talking about interprovincial travel. We need to take this very seriously and find ways to limit our travel in a concrete way.
We're looking at the vaccine rollout. The blame game is going on, right? The provinces are saying the federal government's way too slow to somehow procure a federal supply of vaccines. Sometimes the federal government's saying, well, sorry, you guys are letting half of these things sit in freezers, and back and forth they go. But there are 13 different medical systems here. We've got, all sorts of different vaccine rollout strategies in the 10 provinces. Mr. Singh, do you think there should have been a single unified national vaccine rollout strategy? So the provinces don't do it themselves, but it's one single vaccine rollout that might allow, I know the federal government's procuring it, but also on the rollout, because clearly the rollout has been an impact on how fast and how much we're getting. Should there have been a national standard and a national rollout strategy?
Well, there absolutely needs to be a better role played by the federal government. The federal government is the only level of government that's in a position to provide leadership. They've got the resources, and there clearly has been a massive failure on the part of the federal government to even provide a clear plan. From the beginning, we said they didn't have a clear plan around vaccines, and it's shown that when you don't have a plan, clearly it impacts not just the procurement, but also the rollout. The provincial governments, certainly, when you look at Ontario, there's been some serious concerns raised about their rollout. But at the end of the day, the rollout and the leadership is very clearly a responsibility that the federal government can step up and provide leadership. There's jurisdictional issues, of course, but the leadership has to be provided at the federal level, and they can do a far better job of organizing and strategically planning out how this rollout happens.
But how? I'm just trying to figure this out. Procurement is a federal responsibility in this case. The rollout is clearly provincial jurisdiction. It's healthcare jurisdiction. It is in their purview. But so what exactly, from a concrete point of view, without stepping on the province's toes, who, by the way, don't want the federal government telling them how to roll this out, what exactly, in your view, then, should the federal government, or could the federal government, do? They
should absolutely be laying out a plan. This is a plan. Look at the plans that have worked in other countries, provide the resources to assess and evaluate the plans that have been effective. We know countries like Denmark have had massive vaccination attempts, or successful massive vaccinations. We look at countries that have worked and then roll out what does that plan look like, and then provide some of the financial supports to help provinces with that rollout. But there's no question that the federal government should be able to provide a plan. And whether provinces take that plan or not, the leadership has to be provided at the federal level to show this is how it's happened in other countries, this is a way to make it work, and here's some support to provide the funding to make it happen.
Right. All right. By the way, just on that, again, it's a jurisdictional issue, but on the long-term care home, just real quick, do you think there should have been national standards earlier at long-term care homes?
Absolutely. With national standards, this is just putting together what the learnings have been, what has worked and what has not worked, what has been an abject failure and what has helped us be more successful. And some of those things we know now, but we need to put them out there very clearly. The quality of the workers' conditions, when workers are well paid, when there's good staffing levels, and when we look at hours of work, not just of hours of pay, those are places, those are long-term care homes, which have been safer, where people have been healthier, where there is low work conditions, low wages, a lack of staffing. We have seen deaths. There's no question about it. We need to have national standards, not study it for a long term, but implement and put forward what have been the best practices, what have been the best guidelines, what works, and put those forward right away. And we need funding that is tied to clear Canada Health principles. The Canada Health Act lays out those principles. We don't want public money going to a for-profit long-term care home that ends up paying out dividends to the shareholders. That's wrong. So we need to have some clear guidelines around not funding for-profit, only supporting not-for-profit, and clearly these are the best ways to keep people safe.
Okay, I got to leave it there. Jagmeet Singh, interesting ideas. We'll find out after the 2 letters you wrote to parliamentarians to get the House back, and on long-term and on paid sick leave for 10 days for federally regulated industries. That's Jagmeet Singh, the leader of the NDP. Thank you, sir.